from the Department of Consumer Affairs. Tom, please stand up. You saw him in the video. The Department of Consumer Affairs is leading a major mission to find the undocumented, the unlicensed doctors in our community. I'm sorry about that. Because a lot of the people that you saw bleach, fix a flat, there's a lot of danger happening in our community. And the more people become unemployed or lose their jobs or don't have the economics, they are going to turn to these doctors who promise everything and don't deliver as much. And you see in the end they turn into emergency. So I really want to thank Janice for her support and guidance, and Jill for being there 24/7 and making sure that everything was right and done appropriately so this program can go national. I am hoping from the bottom of my heart that it does. And Rick, you were terrific in that editing room, and so were you, Steve, in getting this done. It has to go from here to the next level.
Thank you, Willie, for your heart and soul that you put into all the production. Jane, we'll go to you to bring our panel up here to give us some more information.
As they're going up, I want you to know that the terrific music that Ana Maria Rosado played is on this CD, and she has some with her. So please, if you get them signed, go to her, get them signed. This is a terrific musician at the top level, and just came here to perform for us. And we got to recognize what you've done. Thank you. She has a new duo called Duo Caramba. I like that.
Good evening. My name is Mary Beth Dixon, and I am with the AARP New Jersey State Office. As Willie Sanchez just said a little while ago, nothing stops us from getting where we want to go. We wanted to provide a panel of experts to give us some context, give us some ideas about what can we do to close these gaps. I would like to take a moment and call up our panel. Let me just acknowledge very quickly, on your program it indicates that Maria Viscarando will be moderating. Sadly, Maria did have an unexpected emergency that came up, so she will not be able to make it this evening. So our thoughts are with her. Let me begin by calling up Linda Flowers from AARP. Colette Lamoth Galette from the state. And Dr. Lester Yepes. All right, I also, while they're making their way up here, would like to just introduce my two colleagues, Julie Marte, Associate State Director for Multicultural Outreach, and Jane Margison, who is Associate State Director for Communications. So behind the scenes, we've been known as the Three Musketeers, I've heard, and we've all been working together, as was mentioned. The last couple of years, we had started this off with a conversation with NJN about this, but before that, the idea was given birth to me by Ida Castro. One wintry morning, we were talking about how can we reach out to the Hispanic population in New Jersey better? How can we reach more people? And Ida Castro, with her wonderful vision, said, go on television. And so she provided us with this vision and explained in a very detailed way everything that we would have to go through. And a couple years later, here we are with this wonderful documentary that we just saw. So I think that we can all agree that this documentary has made us much more aware of the health disparities and the resulting human costs that are happening within our Hispanic Latino population. According to the Kaiser Family Foundation, in New Jersey in 2009, an estimated 32%, almost 1/3 of our Hispanic Latino citizens are currently without insurance. This is a huge disparity that has tremendous economic and human implications for all of us. As a staff member with AARP, I've been on the ground and in the trenches with many of you working to bridge these gaps. And we've worked with Tremendously Trenton. Could I just have a show of hands of all of our partners from Tremendously Trenton? You all were in the, we saw images from the documentary. This is a group of healthcare providers and interested organizations that really are working on the ground in Trenton to bridge the gaps. It's people who volunteer their own resources and their organization's resources. So, we have been on the ground with you, and I've been touched by your passion and confounded by the complexities of these problems, right alongside with you. Tonight, we want to take an opportunity to ask a panel of experts who are here what can be done to close these gaps. We have 3 panelists this evening representing the work that has been done on the federal level, the state level, and the local health provider level. We've asked each of them to prepare remarks which address the following questions. What has already taken place within your area of expertise to address health disparities within the Hispanic Latino population? What is the next step that needs to happen within your field? And what is one thing that each of us can do when we leave here tonight to try to close these gaps? Each of our panelists will address these questions. Following the third panelist's remarks, we will open our discussion to the audience for your questions about Hispanics and healthcare. I will cue the panelists when 2 minutes and 1 minute remain. Just so you know, here are the signs. So I now want to turn things over to Julie Marte.
Thank you, Mary Beth. Good evening, everyone. I would like to start by introducing Linda Flowers, Senior Strategic Policy Advisor for AARP. Linda will speak about what is happening on the federal level and also what are the next steps. Linda is focused on issues related to Medicaid, racial and ethnic disparities, and public health. She has held senior policy positions with the National Academy for State Health Policy and the Medical Assistant Administration of the Government of the District of Columbia. Before going to DC Medicaid, Linda worked on immigration and Medicaid issues at the National Conference and State Legislators. She received her undergraduate degree in nursing from the University of Wisconsin. Her master's degree is in nursing administration from Georgetown University and her JD from Golden Gate University. Linda Flowers.
I just want to say what a pleasure it is to be here and to compliment Mr. Sanchez on a wonderful, wonderful documentary that really captures almost all of the issues that touch on racial and ethnic disparities in this country. So I commend you and your team for a wonderful video, and I just want to say how proud I am to be associated with the organization that sponsors this important documentary. So with that, I'd like to highlight some of the provisions in the new federal health reform law that are designed to get at some of these disparities. And the first thing I'd like to talk about are the coverage expansions. And those are, there's a Medicaid expansion in the new law that will bring hundreds of thousands of minorities, people of color, into coverage. And will cover people who are at the lowest income scale, between 0 and 133% of poverty. And these are people who previously were not eligible for Medicaid because they didn't have any attachment to children or in families. So these are childless adults and other individuals who have no attachment to children who will now have access to Medicaid. And this is a huge, huge shift in the Medicaid program. And then layered on top of that are some subsidies that for people who can't access Medicaid because they're a little bit over income, but are still low income people, they will be able to access federal subsidies to purchase health insurance and what we're going to be calling health insurance exchanges, which will be starting in 2014. There's also a tremendous amount of funding for community health centers in this new law. And as many of you know, well over third of people of color get their care in community health centers. So this is going to be a tremendous opportunity to increase access on that front. There are also incentives in the bill, and the documentary pointed to this, that we are having issues around workforce, adequacy of workforce. So there are some incentives in the bill to increase the amount of minorities in the healthcare workforce. And those are going to be taking the form of loan repayments, training grants, and expansion of the National Health Services Corps. So those are some of the things on the provider front. There's also a requirement in the law that anyone that's receiving, any health provider that's receiving federal funding will now be required to collect data on race and ethnicity. And as one of the persons in the documentary referred to, with this data, we now have evidence to move us forward to get the resources that we need to really try to dig in and address these disparities. So one of the important educational pieces around this is educating people about the importance of being willing to identify themselves, their racial and ethnicity connections, so that we can really get some robust data and use that data to drive funding and other opportunities to address disparities. In terms of next steps, one of the things that didn't make the final cut in the bill, it was in the House bill, but it didn't make the final version of the health reform law, was a provision that would, for the first time, had provided funding for language access to health care. A very, very important barrier for lots and lots of people in this country. And so that, for me, is the natural next step. As we continue to work toward addressing disparities, I would like to see us come together around an initiative that pushes the federal government to look at opportunities to both fund access to language services in Medicare, Medicaid, and in private sector programs. This is critical because without this language access, we don't get good health outcomes. We don't get good compliance with health regimens. We don't build that trust among the people that really seek and need this care. So that's an important next step. And then finally, going forward as a call to action, I would just say that it's really important to stay vigilant, both at the state and federal and local level, looking for opportunities to really shore up those activities and those initiatives that are funded to address disparities, and to make sure when there's opportunity, when people try to cut those fundings, that we're right there at the forefront, trying to say, no, this is really important, and these are the reasons why. And without these initiatives, we're really not going to be able to bring down healthcare costs. Because as was mentioned in the movie, overuse, underuse, inappropriate use are all associated with disparities in care, lack of cultural competency, lack of language access. So these are important strategies that we need to make the argument that these are tools for us to rein in healthcare costs and increase people's quality of care. And I thank you for the time, and I'm happy to take questions.
Thank you, Ms. Flowers. And now I'd like to introduce Colette Lamothe-Gillette, Acting Executive Director of the Department of Health and Senior Services, Office of Minority and Multicultural Health, and invite her to speak about what is happening at the state level and also what are the next steps. Ms. Lamothe-Gillette began her career at NJDHSS in 2004 as a research scientist within its Center for Health Statistics. She served as a liaison to OMMH from CHS and authored numerous publications on the topic of health disparities in New Jersey. She was also the primary author of the NJDHSS's first policy on the collection and report of race, ethnicity data for the department and its grantees in 2007. Prior to joining New Jersey DHSS, Ms. Lamothe-Gillette managed social and policy research projects as a survey specialist within the Survey Design and Data Collection Division of Mathematica Policy Research. Mathematica conducts policy research and surveys in healthcare, education, welfare, employment, nutrition, and early childhood. Ms. Lamothe-Gillette received a master's degree in public health from Yale University in 2000 and a Bachelor of Arts degree from the University of Pennsylvania in 1996. Ms. Colette Lamothe.
I want to thank Mr. Sanchez and commend you on your wonderful work in this documentary. You really did, well, I got my hands now. A fabulous job of raising awareness on the health disparities that face the Latino community in New Jersey. I recognize a lot of of the people in the documentary as partners of the Office of Minority and Multicultural Health and the Department of Health and Senior Services. What we do over at OMMH, 60% of our funding goes to community outreach for chronic diseases such as pediatric asthma, diabetes. Recently we gave a set of grants to 9 community-based organizations to do a chronic disease self-management program, which is an evidence-based program which is done at the community level. And this time, we've been funding organizations for about 3 years, and this time we were able to give 5 agencies to administer the program in Spanish language throughout the state. We have in the department a great dedication to targeting all of our initiatives to the individuals and the populations who have the greatest health disparities. Coming from the Center for Health Statistics, I lived those numbers for years, and I was always struck by them. You know, they for some people they're just numbers, but I lived them. Being born and raised in New Jersey, born to immigrant parents myself, born in a household where the primary language was not English as well. You know, I lived all these barriers, have a couple of chronic conditions myself. So I look forward every day to evaluating the data that we've collected and using that to inform the policies and the programs that we're doing, that we run through the Office of Minority and Multicultural Health, as well as through the department. We, in 2007, released the Disparities Plan. It was the first strategic plan to eliminate health disparities in the department, and as well as the only one in the region. And it spoke specifically to disparities within the racial ethnic subgroups of New Jersey in 13 chronic disease, infectious, and access areas that were designated by the New Jersey State Legislature. Part of that initiative involved us addressing a few infrastructure areas in terms of data, race and ethnicity data collection, cultural competency in delivery of services, increasing the number of minorities in health professions, as well as, there's always the fourth one, it'll come back to me, but every one of them was addressed here in this documentary, which I was pleased to see. We also, we have, through our diabetes initiative, we fund organizations to go out into their community, conduct outreach, identify people who are at high risk or high risk for diabetes, and then refer them to services. Through our Minority and Multicultural Health Month, which is September every year in New Jersey, we partner with a slew of organizations to raise awareness of the health disparities and health issues around the state. In terms of the next priority to confront the issues that minority communities in New Jersey face, we are actively conducting an evaluation of existing public health programs and policies through the department to evaluate them for effectiveness and efficiency. And going forward, we want to make sure that we are supporting programming that is having the best impact on minority communities in New Jersey. We see healthcare reform as an amazing opportunity to maximize the benefits to the minority and multicultural population of New Jersey. And then in terms of community actions, to borrow the name of our chronic disease self-management program in New Jersey, it's called Take Control of Your Health, or also Tomando Control de tu Salud, excuse my bad Spanish. What we want to do is encourage communities to take action, first starting with yourself, and evaluate your own personal health situation. You know, think about what one way you can change something that you're doing to make your life healthier, and then extend that to your family and extend that to your community. And that's all. I'll take questions later. Thank you.
And now I'd like to introduce Dr. Nestor Yepes of Windsor Medical Pediatrics to speak about what is happening on the local provider level and also about next steps. Dr. Nestor Yepes obtained his medical degree in Colombia, where he worked as a pediatric specialist before moving to the United States in 1993. In 1996, he completed the Mammonoids Medical Center Pediatric Residency Program in Brooklyn, New York. Since June 2000, he has been board certified in pediatrics. During the last 9 years, he has worked in urgent pediatric care at the Robert Wood Johnson University Hospital, with St. Francis Medical Center in Trenton, and with Pedadoc in Perth Amboy. Currently, he runs a private pediatric practice. He recently opened an office in Trenton, a federally designated medically underserved area. His practice strives to address the bilingual needs of Trenton's youngest citizens, regardless of whether or not they have insurance. From 2005 to 2009, he served as president of HAMA. In 2010, he joined the Tremendously Trenton Health Fair Partners as medical director to help guide Trenton's largest fall health fair. Dr. Yepes.
Thank you very much for this invitation. I think that this is a great opportunity to address something that I have in mind as a foreign graduate doctor. I need to address a little bit or point out several things that I need to commit during my 13 or 14 years to get my certification as a primary care physician in the United States. Everything that I faced at that time as a doctor, I need to face also as a citizen, as a patient, as a new worker, as a new person that need to learn about the system in this country. I think that the situation for the Latino, or to the disparity between, or the health disparity between Latinos, is a complex interaction between genetic variation, environmental factor, and specific behavior. I'm going to headline some numbers. It's amazing to think about it. 46 million of Americans do not have health insurance at this point or at this time. This is a tremendous challenge mainly for Latinos, because the gap between Latino and other ethnic groups every day, I think, for my own experience, is bigger and bigger and bigger. What are the reasons, or what are the contributions to this ethnic disparity? We have detected as a primary care physician several points that for me are very important to address tonight. Socioeconomic factors. And socioeconomic factors is related directly with education. Education, education, education. I think this is the target point for the Latino community. Education not only at lower level. Latino has to be educated at high level, since elementary school, high school, college, and university of high degree education. Because as a doctor, I have noticed that every day, less and less physicians work in the Latino community because they have the barrier of the language, or they don't understand the Latino community per se. As a doctor, as a primary care physician, I think the lifestyle behavior is very important to address in the Hispanic community. They mention in the documentary about physical activity, alcohol intake, diabetes, cardiovascular disease, all those diseases. If we have a good coverage as a primary care physician for those patients, probably we can decrease the amount of patients that are going to develop this complication in long term. The other thing I want to address is the social environmental. Again, I want to repeat about education. Education is the most important for me as a primary care physician, is the clue to break or decrease or close this gap between Latinos and other ethnic communities. Latinos need to understand that how they can have access to the preventive healthcare program. They mentioned there are a lot of programs that many of our citizens, they don't know that they exist, like asthma program, diabetes program, hypertension program. We need to educate the Latino community how they can have access to this screening program. It's not detect the problem when the problem already exists. We need to do preventive medicine. If we do preventive medicine, we are going to decrease the cost. Patients are not going to, for any single disease, go straight to the emergency room to get resolve this problem. Because this is why the system is very, very expensive. Primary care physician can do a good approach and decrease the cost of medicine if we educate our patients when they need to use the emergency room facilities or when they need to the high level of medicine to be treated for any single problem. I want to point also as a pediatrician, we have an excellent program that many Latino children, they don't have access. More than 7 in 10 Latinos children without insurance are eligible for coverage through Medicaid or state children health insurance program. However, those children are not enrolled in this program because what is the reason? They don't know that this program exists. We have a special, excellent vaccine for children program that we provide free vaccine for all children born in the United States. It doesn't matter if they have insurance or they don't have insurance, but the parents don't know for education, lingual barrier, or sometimes they refuse to have access to the service because they have malconception about vaccine or any of those programs that can prevent all those diseases. I think if we work together as a primary care physician in local area, we can try to close a little bit the gap between what patient can get benefit of all those programs that we have for not only for the Hispanic community, but for all other ethnic groups that can get benefit of this excellent program that we have today.
Thank you,
Thank
Dr. Yepes.
One of the things that I really liked about when I first conversations with Willie Sanchez was when he said we need to give people something to make things better. So we have 3 experts in front of us today and a whole room full of people who are interested in trying to make things better. We wanted to give you an opportunity to ask questions to our 3 panelists. We have a microphone and let me just see who. Douglas has the microphone. If you have a question for the panelists, if you could raise your hand, and we will come over to you. It looks like we have a question up here in the front of the room.
I'm trying to get this to work.
Daniel.
I can almost talk without the microphone, but stretch it. Daniel Santopietro, and for the last 10 years I've been working on these issues with a lot of I enjoyed seeing the people in the film. And I think the genius of Willie Sanchez, really comes through in this. To use the kids, where'd he go? To use the kids, to use the queens as an intro to get us into this extremely complex topic, and make it not only emotional, but actually and educational, but to combine that is really takes a lot of genius. The question I would like to ask you is, we have all been listening the last few days about repealing the healthcare reform. And, I would like to think it's not possible, but I'm really worried because for the Latino community, although we would have preferred a Medicare for all approach, or, you know, most of us would have. Clearly, the healthcare reform is necessary to make any progress on the lines of what we're talking about, and any going backwards would be a disaster for our community. It'll confuse people much more and make matters worse. I want to know what your thoughts are on this, what you think can be done, and pray that we don't have to worry about this.
Well, I think prayer is a good thing. Apart from that, just from what I'm reading in the press and hearing at the federal level, it seems unlikely that there would be an outright repeal. There may be some efforts to slow things down or to sort of pull back on certain areas. My view is it's unlikely that we would see an outright repeal because of the configuration of the Senate, and also because there's not enough. There probably would not be enough votes to override a presidential veto. So that would be mine. And Bob, do you have anything on that? Say about that.
All right, I see another hand up over there.
First of all, let me I just want to introduce myself. My name is Phil Klein. I'm an obstetrician gynecologist in Woodbridge Township. I studied in Mexico and I did my residency in Newark. So and about 60 to 70% of my patients are Latino. The documentary was fantastic. I've seen it all, and it's right on the money. One of the problems that we as physicians have is that we would love to give more of our time if we could. However, one, we have an issue of malpractice because we're putting ourselves in the middle of we don't know what. Two, there is no way for us to give up our time to charitable functions such as the clinics that we were talking about here. Now, I know other professions get incentives, tax incentives or whatever, to give of their time. Physicians do not. We've brought it up at the hospital levels. I was past president of Union County Medical Society. I'm on the board of the New Jersey OBGYN Society. There are no means that the government will allow us to give up our time and to get anything other than a pat on the back. Now, it's very good for giving a little bit of time, but if we want to get more physicians who would love to be involved, we need something from the government to say, hey, we really appreciate your time and we're going to make things a little easier for the docs. We'd love to help. We need some help from the government also.
All right, so it sounds like your question is posed to our colleagues here on the federal and the state level, and perhaps Dr. Yebes might want to weigh in as well.
I'll just say that I know that part of healthcare reform is dedicated to increasing the physician workforce, and our commissioner is very dedicated to improving the circumstance around the physician in New Jersey as well. She's developing a physician task force to evaluate methods of keeping physicians in New Jersey. First off, too many are trained here and go to other states to practice because of the issues of malpractice and the like, and she has convened a group to evaluate and then provide recommendations on what we're going to do next to address this.
I would just add to that in the reform bill, there is a provision that provides some isolation from lawsuits for people who are volunteering their time to provide health care. In terms of the tax deductibility, the charitable worth of this activity, that would be something I would have to see more on the pros and cons. I'm not really familiar with how that would be implemented and what the IRS is saying about how that, why they're saying they don't think this is something that could be translated. But one thing that comes to mind is probably almost everybody in every profession would want to take advantage of an opportunity to say, I volunteer my carpentry skills, why shouldn't I write the, so I think there's a lot of implications there that have to be explored, but it's a good issue, and I'm going to see if I can learn more about it.
Yeah, as a primary care physician, we know that this will be a big challenge for the new reform, satisfy all the specialty doctors, because it's a complex problem, it's not easy. Some of the possible solution for doctors will be to decrease, for example, the healthcare insurance. I know for UIN, malpractice insurance costs average more than $150,000 a year. That makes this problem or this situation a little complex, because who's going to pay for malpractice insurance of different specialties? There are another possibilities, tax incentive to reduce malpractice insurance. I don't know if it's going to work or not, or create like a health saving account or save money tax-free for healthcare service. We are not in the position to give a straight direction what we can do to improve this situation, but several institutions are working to make this program work in the best way, for the best interest for the patient, without to consider the healthcare professional situation also.
And if I could just add in my own 2 cents, I know that tremendously Trenton depends on the generosity of providers to help out, and despite the fact that people don't get a tax incentive, we do have a number of providers, many of whom are in this room, who come out and volunteer services, and we are in great appreciation of that, and hope that that continues. We have time for another question.
My name is Mary Elena Vargas, and I am Executive Director for the Center for Nursing Practice at Englewood Hospital and Medical Center. I would like to say that I agree with the physician that there has to be incentives for healthcare professionals to help out, because all of us have to chip in. This is a system that needs help, and we need to help being the providers and knowing the system problems that we have. However, I have to add that advanced practice nurse practitioners have a great deal to give to health care, and we need to promote that group of people, letting them have more resources and giving them more freedom to practice independently. Another thing that I would have to add is also who makes the number about the limit for Medicaid and for Medicaid services. I mean, that's a ridiculous number. A lot of people are working and they're paying for an apartment, they're paying for food, and they have nothing left to buy Tylenol, to buy Advil. I mean, I think we have to look at that also. The fact that we're leaving out such a huge number of people just because they're responsible and they're working and they went to school and they have a job to pay for their apartment, to pay for their food. That's a ridiculous number, and we need to look at that again.
If I can just jump in for a second. I know all of you want to shake the maracas for the nurses. I heard them.
I'll just say that you hit upon an issue that's near and dear to the hearts of AARP workers. We very much support advanced practice nursing. We house the Center to Champion Nursing, and our center has been at the forefront of lobbying the federal government on our lobbying side to push for advanced practice nursing. We support the findings of the recently released IOM report that also calls for expanded scopes of practice for advanced practice nurses, so we are right in lockstep with you on that issue. In terms of the Medicaid expansion, as you probably know, over the years since 1965 when the program was first developed, it has the income levels for various categories of eligible groups has expanded over time. We see this as the first marker, a historic marker, in the sense that people who formerly were never able to access Medicaid, those childless adults, lots of them men, lots of them 50 to 64 who were in that gap age before they could get to Medicare, are now able to access the program, albeit maybe not at the highest income levels that we would like to see. But we know that these programs move incrementally. We finally, after years and years, got a Part D to Medicare. So we have the marker, and we work together to improve these programs over time.
All right, do we have another question? I'm seeing a hand move over. Oh, we've got another one from this table.
Hi, I'm Gina Miranda Diaz. I am a registered nurse, and I am faculty for Ramapo College at Inglewood Hospital. I was listening to the documentary, which I loved, and I really can't wait to get a hold of this copy. I was just concerned, not concerned, but I was listening to some of the things we talked about the state health insurance programs. Full vaccines are provided. My concern is that it's provided only to children born in the United States of America. And I understand that people are saying, I can't even afford health care for myself. Why should I be paying for health care for people who are not documented in this country? I hear you, I understand it. But if that kid gets sick and comes into the emergency room, you better be sure you're going to be waiting another 3-4 hours for your kid to get his cast set because somebody's coming into the hospital who got whooping cough. I know that in Newark, they were having an increase in pertussis and whooping cough, and we had to all get vaccinated. So we're moving ahead, but we still have a lot of barriers, and I know we can't solve everything today. But the disparities is not only about adults, it's not only about race, it's about children, it's definitely about socioeconomic status. And we're going to, as long as we continue to sort of marginalize certain individuals for whatever reasons, whether they be legal, federal, state laws, we're still going to have disparities and we're still going to have these problems.
So it sounds like your question is, what are the resources for children who are not eligible for family care to receive vaccinations?
That is a difficult situation for immigrants when they came to the country with children, because by law, only the children who are born in the United States, they can have access to this program. Sometimes they bring a vaccine record for their own country, but this is an issue that needs to be addressed, because there is no point to have children in the school system that have complete immunization record. They are born here, or they immigrant, or they are legal in this country, and also they have a student that, because the immigration status, they cannot receive or they don't have access to this program. The government has to do something to close this gap, because there is no point to have good coverage immunization for one group of children and the other group are unprotected, because they can transmit the disease to the children that already received all the attention in this situation. I think that problem has to be addressed with every state health department, how they can cover this segment of the population that don't have insurance or don't have access to the healthcare system, how they can protect those kids with the same immunization or the same schedule of immunization that we have for children that are born or raised in the United States. This is a tremendous problem.
I'll second that. It's a tremendous problem. The whole idea of immunization is that everyone needs to be immunized to protect the entire community. So this is an area that we all need to work on to figure out how we're going to protect all of the children in New Jersey.
I think if Maria Viscarando was here this evening, she would probably be mentioning the vaccination drives that are in Newark, and I will plug tremendously Trenton's efforts to ensure that all children insured or uninsured, have been vaccinated, as many as can be. I see the hand of one Ms. Gail Daly, another nurse.
I'm a nurse practitioner too. We are talking about all of the government services. Oh, I have a little question. If that child their parents become citizens, are they then covered? Oh, okay, so not just born in the United States, but are citizens. Okay, as born here or citizens. My question is, we're talking a lot about government services. What about charity services? You know, and of course, along with government, I'm confusing you now, did everybody vote? It's the community, you know, a lot of people, immigrants, you know, become citizens and they can vote. Let's make sure everybody knows what they're getting when they vote. They don't listen to the news blips and lies that are told, and listen to find out what really goes on, and that's part of education. And then that everybody who can votes. But what about charitable organizations? Is there a way of rallying and pulling together for maybe something like immunizations for undocumented children or ineligible children?
Yes, there is.
I'm hearing some yes, there is.
Yes, there is. I do fundraising.
Okay. Does the panel want to comment on that, or should we bump it to one of our audience experts?
Do we have anyone from the
Audience
FQHCs here? That's basically.
Yeah.
We do.
The primary health care centers do treat all residents of New Jersey, even those who are undocumented.
Okay, we can.
You can't reach everybody.
Yeah. And it's also important to note that states do have the option to provide access to Medicaid coverage for undocumented immigrants with their own funds. They won't get the federal funding, but they can use their own funds, and some states have chosen to do that. And in those states, those children can access Medicaid and all the benefits that flow from that. So. But there's a huge role, I think, for the safety net groups and the charitable organizations in this.
Did you want to give
Yes,
us?
I did. I don't see.
My name is Nina Hernandez, and I do fundraising. And the same way that we raise funds for so many other organizations and for the sick and for people that are needy and hungry, why can't we raise money for vaccinations for people that are undocumented? After all, they are for our children. And these children, somewhere along the lines, they're going to become citizens. And the children are our future, so why not? The same way. I mean, I know it's a totally different issue. But the numbers make a difference, and why not?
Come on.
And not having access to insurance is also an issue. It's an issue that, millions of Americans face as well. I see two eager hands over here.
Hi, my name is Cynthia Slade, and I work with NJ Family Care. I'm actually the outreach manager for NJ Family Care. And we have a number of different strategies to try to reach this community. And I think in some instances we're making a lot of progress. In other instances, there is a barrier. We've tried to overcome that in a number of different ways. We have a number of people in our staff who look like the community that we're trying to reach. We have partnered with a number of the community-based organizations. We're out there in the schools. We work Sunday through Saturday, early in the morning, late at night, to try to reach the community. And we've even started coming, I believe, to your office, doctor, because the community trusts you. And so we're out there trying to take applications at the same time. So my question is, in all the strategies that we're using, we would like to continue with the strategy of working with doctors who are out on the front lines and trying to reach the people as they come in to sign them up for NJ Family Care. So my question is, do you have that network for places, especially like Sussex County and Hunterdon County and Warren County, and Ocean County? Those are the counties that we have the most difficulty in trying to penetrate the Latino population. So if you have any contacts that we could do the same thing that we're doing with you, I would really appreciate it.
Yeah, we are going to put together all the pieces with other doctors in the area. We're trying to be more involved in this program. I think if we get the contact with all those other office or primary care office, probably we can make a bigger and bigger group to help this community to update all the information, plans, healthcare, everything they need to have access. I think it will be wonderful.
One of our new grantees is in Hunterdon County, so I'll talk to you afterwards about continuing with that.
Excellent, wonderful networking to help the community. We have time for one more question.
Good afternoon, my name is Marita Raimundi. I work for Children's Home Society of New Jersey, and I am the Director of Family Support Services and Latino Services there. One thing that I see that's been missed in the discussion is a proper use of medical interpreters, because we've been talking a lot about language barriers, but we really need to provide the professionals with the right skills to be able to do their job. And sometimes we talk about liability and insurance and malpractice, but a lot of it has to do a lot with who is doing the interpretation or who's providing the translations. And I just wanted to ask a question in terms of how do you see the state providing additional services for the nurses, the staff, the medical personnel to really get certified and trained to do proper interpretation and translations, which are two very different things. I do provide translations. I'm certified as a translator, and I received training in medical interpretation, and I see the big changes that can happen when someone really does a very poor job. Good intentions, but poor job.
The department has several initiatives which are targeted at medical interpretation. We had within our own office a couple of pilot projects which we try to do in the different regions of the states, where we went into the hospitals and trained bilingual staff on how to be medical interpreters, because it's key. Not everyone who speaks the native language can communicate the information in a way that is effective and consistent with what the medical professional needs the patient to understand. And so we've had a couple of those, and we're trying to do more throughout the state. We also have a longstanding partnership with the New Jersey Hospital Association, where we've participated in some workshops with them and talked to them about ways of better providing those kind of services within a hospital. There's a the federal cultural linguistic and class standards, yes, which I'm always forgetting what the acronym stands for, but those require, appropriate services. They mandate healthcare providers healthcare providing facilities to provide interpretation services and translation as appropriate for the targeted community. So that is one of the initiatives that we are very supportive of in the office and in the department. And going forward, we'll still be looking for other opportunities to fund those kind of initiatives throughout the state.
And printed literature in the communities. Like a large amount of printed literature, bilingual, in the communities?
We use part of our funding to provide translated materials in multiple languages.
Community?
Oh, yeah. Yeah, we, for example, when H1N1 hit last year, we got massive amounts of different language material that was distributed to our community-based organization partners, specifically our grantees, as well as anyone else who made the request. We get requests all the time for different language materials. And as we are able to provide, I brought a bunch here today. In fact, if anyone's interested in some health promotion, obesity prevention, diabetes prevention literature, both in English and in Spanish.
I'd like to now call up Jane Margison. We're going to be wrapping up in a few minutes, but we wanted to take a little bit of time just to quickly summarize some of the calls to action that you've heard this evening. It's been a wonderful evening, and we want to just refresh your memory with some of those for us to keep in mind.
Thank you very much. I'm seeing one last question.
Yeah, I have one more question. I came to this country in 1974. I had to learn English. I worked at a factory and I went to college from 5 p.m. to 10 p.m. So I could learn how to speak English. As far as I know, that's the language we speak in this country. Why can't other people learn English like you have as a doctor, like everybody else here? Why can't they learn English? And then we don't need all these programs where we need to translate. We need to have papers done in different languages. People go through their licenses, any tests they have to do in all different. Why? This is the United States of America. We speak English in this country. And I'm Spanish. I was born in Uruguay. I came here at the age of 19. And I went to school. I went to school on my own and I didn't speak English. And back in 1974, I worked at a factory by name of Revlon.
If I could just
3,000 people and no one spoke Spanish but me. And you know what? I survived. I learned English.
All right, so I just want to bring us back to the scope of the panel, which is about Hispanics and healthcare. So we're going to go ahead with the closing remarks.
Okay, so thank you very much, Mary Beth, who I know at a moment's notice jumped in when unfortunately Maria Viscaranda was not able to be with us. So let's have a round of applause first. And indeed, our panel, what an absolute pleasure and honestly an honor for all of us that you were able to join us, that you took the time out of incredibly busy schedules to be here. And it's really, I think, very indicative of how important this issue is, the many, many issues that were raised. I said to Willie earlier this evening, I really don't know how you managed to pack so many pieces into a 30-minute documentary. I mean, it's really astounding. As a member of the AARP New Jersey team, it's really been quite a sincere pleasure to be a part of this project. And the issues that we were hearing about tonight, that we saw in the documentary, that we heard about, I found very moving and I found very interesting as well. And I think the three things that kind of, stick with us so much revolve around, education is clearly such an important part of this, of making people aware of the programs that do exist, continuing to work at the community level with local organizations, with our government, with our state structure, with our federal government, to raise awareness and hopefully along the way to start to reduce the mistrust that we're hearing about and the appalling things that happen when people take other steps because they don't trust or they don't understand or they're misreading, prescription bottles. And I know Willie shared a story that I guess didn't make it into the film, but a woman who misread the bottle that said, take this pill once a day, and I understand the word ONCE in Spanish means 11, and so she almost, took too many and could have gone, I believe, into cardiac arrest. It was an absolute disaster waiting to happen, and these are the cases that are going on every day. So, our thanks to so many of you in this room who are taking that time to educate and to stay committed to working with all the entities at hand. Another theme that we're hearing a lot in some of the questions and also in the piece, we're looking for ways to keep the funding where it needs to be. I was happy to hear from Colette that there's an initiative to really examine those that are the most effective and are really making the difference so that you can help to funnel and to channel the funding and keep it moving forward and keep bringing in the partners and bringing in the local communities and keeping everybody involved. And to that end, The third thing I'm hearing a lot too, and I'm certainly going to be looking at this myself, and I'm happy to report that I do walk 2 miles a day with one of my colleagues from work, but besides that, I have many other ways I could look at other unhealthy behaviors, but taking control of our own health and being a part of the process, you know, starts with each one of us and grows from there, and I think so much building can happen right from that, you know, one place, which is each one of us in the room. And I hope that those are maybe some of the things that you will take with you as the action steps that we've been talking about, to bring forth. And as part of this, you know, I think the 30-minute documentary that we saw that did pack so much into it is such a wonderful place to start those important conversations. And I'm happy to tell you that for all of you who are here tonight,